And welcome back. Well, the National Health Index evaluates health and health care in the metropolitan areas across the entire country.
Yeah, it identifies key factors in each community to help you achieve a healthier lifestyle. Here's Andrea Pearson from Healthgrades with some highlights on this data.
We organized the Healthgrades Health Index to look at the health care in America across all cities, and we've ranked 3 cities at the top of that list. Those cities are Minneapolis, Denver, Sacramento, and they each rank for a different reason. So in Minneapolis, people have taken really good care of themselves and they have great access to physicians. In Denver, people live healthy, active lifestyles, and in Sacramento, they have exceptional access to really high-quality hospital care. The Health Index measures 4 things. We look at what the population's access to their physicians are, and are they covered by insurance. We look at their access to really high-quality hospital care in those cities. And then we look at what are the behaviors that people have in those cities. They take care of themselves, they exercise, eat right, manage their stress. And the last thing we looked at was what are the behaviors that can take away from your health, the risky behaviors that we sometimes take into our lives. Things like heavy drinking or smoking would be good examples of the enemies to our health in those cities. Well, it's really important in Milwaukee. You rank quite high at number 7, and you rank quite high because you have great access to health care in Milwaukee. And the things that you could manage a little bit better are some of those risky behaviors that we talked about. And it's important because in healthcare, knowledge is really power. And we're trying to put the information together so that consumers can use the Healthgrades Health Index, understand what the quality of care that's available and how they can make healthier decisions and healthier choices for their families and for themselves. I think there's a lot of great available information. So I would start with, which physicians are you selecting, and are you being choosy in looking at physicians who really have experience treating the health needs that you have? And I would look the same way at the health care that is given by hospitals. There's great variability in care, and if you make a choice of between 1 or 2 hospitals, you can have a big impact on your rate of complication, and sometimes even mortality rates can vary greatly, 70 or 80% in some cities. So the city-by-city health index is available at healthgrades.com. You can look at your city, you can see how your city compares to others in the region and nationally, and you can get all of the information and access to how do I research my physicians, my hospitals, and even read stories from other patients that live in your city about decisions that they've made and how they've navigated their care from diagnosis to treatment and recovery.
All right, that website again is healthgrades.com.